Hi there, my name is Jan Marie Smith, and what I'm going to show you how to do today is calm the nervous system with tapping and guided meditation. And as you all probably know, one of the things that happens with histamine releases and with mast cell diseases is our nervous system gets a bit jacked up at times. So this is something you can keep in your toolbox to calm your system down and hopefully bring yourself back down to a state of grounding and awareness. So the tapping points we're going to do are going to be the karate chop side of the hand here, and I'll just be saying side of the hand. I'll walk you through this. I do recommend you keep your eyes closed, but if you need to open your eyes to see what I'm doing at any time, that's fine. And then we're just going to have these two fingers, right or left hand, doesn't matter. And the side you tap on doesn't matter. So I'm going to say again, karate chop point or side of the hand. Then we're going to go to the forehead, side of the eyes, under the eyes. And you can do this bilaterally with two fingers on both sides, or again, just one side. Under the nose, under the mouth. And then we're going to go to the collarbone. And then under the arm. Some people find it awkward to go the opposite side. So you can do what we call chicken wing and just go under the arm like this. And then we'll go to the top of the head. All right, so if you're ready, let's take in a nice deep breath. You can inhale through your nose. Yes, and out through the mouth. Let's do a couple of those just again to center and ground. And I'll be walking you through this, as I mentioned. Another breath in. Another breath out. Again, letting the eyes relax. And then you can just say this in your mind and follow along with me. Start with tapping on the side of the hand. It does not matter which hand or which side. And with the eyes closed or even open, whichever feels good to you. Even though mast cell disease is very challenging, I know I can do this. Keep tapping on the side of the hand. Even though this is hard to explain to family and friends, I accept where I am and accept the challenge that has been laid forth in front of me. Again, continue a nice calming breath above the eyebrows. Even though I have good days and bad days, and sometimes symptoms and issues and things I don't understand, I'm going to accept those challenges and know that I can ride things out. Again, don't hold your breath. Keep breathing. Going to the side of the eye now. Again, two fingers on each side or one. Even though some of the things that happen to me in a day are a mystery, I can use this tapping as one of my tools to calm down my histamine reactions, my nervousness, and my overall sense of well-being. Keep tapping. And now under the nose, I am whole and lovable just the way I am. And deep breath in and out. Underneath the mouth. And to some degree, I want to make friends with these mast cell issues, so I'm not constantly fighting an imaginary or real enemy with this disease. Collarbone, I accept that I will have good days and bad, and I will be able to manage this anxiety. Under the arm, I trust in the doctors and the nurses and the researchers that are involved with finding a cure or ways to stabilize our mast cell issues. And then you can keep repeating this in your mind, or you can just listen. Top of the head, I want to give myself love and acceptance every day. And then the eyebrow point, I want to nourish my body with good thoughts. I want to nourish my body with a sense of acceptance, understanding that just because I have a mast cell disease or histamine issues, I can overcome them to some degree. Side of the eye, I want to be able to be calm, and I want to have the tools to calm myself. Again, nice deep breath under the nose. I cannot stress myself to a solution, so acceptance is a part of this. Under the nose, under the mouth, I want to make sure that I have tools in my toolkit to do this, to calm myself down. And collarbone, I am whole and I'm more than adequate. I am wonderful. And then under the arm, I will find my way through this. And then on top of the head, there are ways I can manage MCAS and mastocytosis and all the things that might come up on a daily, weekly, even hourly basis. Now you can stop tapping. Again, gently close the eyes if you haven't yet. Take a big deep breath in and out. And continue with about 10 more deep breath in, deep breath out, pausing if you need to. Thank you for joining us today. Namaste.
It is such an honor to be here today. I'm very excited to be speaking with you. My name is Jennifer Nicoloro Santa Barbara, and I am a health psychologist. I'm an investigator in the Department of Psychiatry at Brigham and Women's Hospital, as well as an affiliated investigator at the Mastocytosis Center at Brigham and Women's Hospital, and an instructor of psychiatry at Harvard Medical School. Today, I'll be giving you a very brief introduction into cognitive behavioral therapy for chronic medical conditions. Chronic illnesses are, by definition, persistent and require continued medical care, and many restrict activities of daily living. Receiving a diagnosis of a chronic illness can be very stressful, as it can influence almost every aspect of a person's life, including their emotions, relationships, and employment. Affected individuals worry about their future, impending physical decline, decrease in activities of daily living, and finances. Chronic illnesses that are rare bear the hardships of chronic illness. They're unremitting, require ongoing medical attention, and are chronically disabling, but pose additional burdens. Limited physician knowledge and atypical symptomatology make diagnosis difficult, resulting in a diagnostic journey that may last several years to decades. And this journey is often characterized by uncertainty, multiple referrals, multiple hospital admissions, and often with unnecessary testing and invasive procedures. Oftentimes, individuals need to change their behavior as part of a new lifestyle, and they find themselves managing complex and changing thoughts, feelings, and behaviors. Cognitive behavioral therapy for chronic medical conditions may help an individual adjust to receiving a diagnosis and living with a chronic medical condition. Cognitive behavioral therapy is a short-term psychological therapy. It involves facilitating problem solving and modifying dysfunctional thinking and behavior. And the premise is that our thoughts affect our behaviors, which affect our emotions, which affect our physical sensations, which affect our thoughts. And you can see that the arrows are bidirectional and that these relationships affect each other. So you can think about two individuals who may have the same physical health problem, yet have markedly different psychological responses. So, for example, someone who was diagnosed with mastocytosis who believes that her ability to make a useful contribution to her life is finished is likely to experience depressed mood and avoidance of previously enjoyed activities. But a different woman with the same condition who acknowledges that her life will have to change, but who believes that she will be able to discover new ways to make a contribution, is likely to make a better psychological adjustment to this illness. These differences in patient psychological responses can be understood by examining patients' thoughts about their illness. This is a fundamental principle behind cognitive behavioral therapy. Sessions of CBT are usually structured around an agreed-upon agenda. An individual is encouraged to participate, and there are homework assignments to do in between sessions. Treatment involves cognitive and behavioral strategies to help gain control over psychological and physical symptoms. And some examples of strategies and behaviors. First, I'll just start over here with behavioral strategies, including active scheduling, active pacing, self-monitoring, and adherence to self-care. I'll go in to a little bit more detail now about the behavioral strategies. So we'll just look at the first one, which is active scheduling. So oftentimes individuals with chronic illnesses decrease their participation in activities previously found to be enjoyable. This can lead to depression and a greater focus on physical symptoms and increased disability. So the idea here is to schedule activities that may be enjoyable and or give a sense of mastery. So the steps include you would do this with your therapist, identifying pleasurable activities, planning a time, anticipating problems now that you have a chronic illness. Are there barriers to this pleasurable activity that you used to engage in? And solving those problems. And then monitoring your emotions before and after the activity. It also involves activity pacing, so finding a balance between activity and rest. Oftentimes, being inactive leads to muscle loss and over time increases disability. And sometimes individuals think that they have to either do too much activity or they do no activity. And so it's really about finding a balance. And we know that doing too much activity can lead to muscle fatigue and strain and increased pain. So this is just a very, very brief introduction to active scheduling, which is one behavioral strategy that you might engage in if you're in cognitive behavioral therapy. I'm going to go back here and look at these cognitive strategies. So the first one is catastrophizing. And maybe as I'm reading these will resonate with you. Maybe you've engaged in them, or maybe you know somebody who has. I mean, I'm sure we all have engaged in some of these strategies at some point in our life, but it's when we engage in them and it starts to impact our social emotional functioning. So for the first one, catastrophizing, is predicting a negative outcome and believing that a negative outcome is a catastrophe. So for example, my life is over because I will always be in pain. Another one is all or nothing thinking. This is categorizing events into either good or bad. An example is, my life was perfect before I got sick. Now my life is horrible. Another one is jumping to conclusions. This is making negative assumptions without enough evidence. So for example, the doctor was late for my appointment. He truly does not care about helping me. And finally, mind reading. This is thinking that one knows what someone else is thinking. So for example, no one will want to date me once they learn that I have mastocytosis. So in cognitive behavioral therapy, you'll work on challenging these maladaptive thought practices. So here's an example of how to challenge this. So the situation, you've been diagnosed with mastocytosis, your negative thoughts. I'm going to be dealing with this for the rest of my life. My friends and family won't want to be around me anymore. You may feel anxiety. The thinking error here is catastrophizing and mind reading. And your therapist would help you challenge this negative thought and reframe it to a more rational response, which might sound something like, yes, I will have to learn to cope with my mastocytosis, but I can do it. I have no evidence that people won't want to be around me. Many people have medical conditions and they do just fine. So this was just a very, very brief introduction to cognitive behavioral therapy for chronic medical conditions. Thank you so much for listening. If you're interested and you want to seek more resources, I put up here the website for Mass General. They have a Center for Cognitive Behavioral Therapy, as well as the Cleveland Clinic and Columbia New York Presbyterian, as well as this is the National Suicide Hotline if you feel like you are struggling and you need help immediately. Thank you so much.
Hi, everybody. My name is Dr. Debbie Miller. I'm a naturopathic physician and a board-certified biofeedback therapist practicing in Seattle, Washington. And mostly in my practice, I practice biofeedback, which is, I like to describe it as physical therapy training, but for your nervous system. So our nervous system is in charge of how we respond to stressful situations. And when we're elevated all the time, it can make us feel a little bit less in control of what's going on inside our bodies. So I teach people how to use their own bodies to regulate themselves. And the feedback part comes from actual sensors that I'll attach to people in a session so they can see different parts of their physiology on the screen, like their breathing, heart rate, muscle tension, finger temperature, and also palm sweat. And these are things that someone can learn how to regulate in an effort to help with stress management and anxiety and many, many other things. So in a nutshell, that's what I do. And the foundation of all of biofeedback training is learning how to breathe in a way that supports your body and your overall health. So I'm going to spend some time today just sharing with you what I teach every patient who comes through my door, which is a little bit of functional breathing. And we breathe all the time and it's free. So I think it's really worth learning how to do it in a way that's helpful for you. And just to give you a little bit of background information on why breathing is such a big deal, it's not so much if we're breathing. If you're watching this, you're breathing, so you're here with us. It's how you breathe that really makes an impact on your body. So how we're breathing affects what part of our nervous system is activated, the more fight or flight survival response versus a more parasympathetic or rest and digest or rest and repair response of our nervous system. How we breathe affects oxygen and nutrient delivery to everywhere in our body. It affects the pH of our blood, our electrolyte balance, which has many implications, circulation, digestion, and something called heart rate variability, which is probably a presentation for another time. But how we breathe influences what goes on in our heart. And there's also a connection between heart and brain as well. But today we're mostly just going to stick with talking about breathing. And this is just a list of some conditions that long-term improper breathing is associated with. And as you can see, it's a pretty long list. It's probably not even a complete list. And these are a lot of really, really, really common conditions. So it's not to say that improper breathing can cause all of these things, but how we breathe plays a role in the activation of our nervous system. And there's, chronic stress also plays a role in many of these conditions or exacerbating them, not necessarily causing them. So just to really hammer this point home, we breathe about 24,000 times a day. That's really a lot of reinforcement for our body to be doing the same thing over and over again. So if your body is stuck through no fault of your own in some kind of unhelpful breathing pattern, it's at that point becomes habitual. So we need to reteach the body how to breathe. There's a really common breathing pattern I see a lot called over breathing, which is a really gentle way of saying low-grade hyperventilation. And when we are doing that subconsciously without realizing it, it can actually make us feel more stressed or anxious. And so it's a two-way street with our mind and our body. What goes on in our mind can influence what goes on in our body, but also the other way around. So how we breathe can really influence the experience of the mind. And just as an example, if we are over breathing, even just for 2 to 3 minutes moderately, that can reduce oxygen delivery to the brain by about 30 to 40%, which is quite a lot. So let's get into things you want to be paying attention to for functional breathing. And this means breathing in a way that's supporting your health, supporting your body. The first thing you want to pay attention to is your posture. So you want to be seated in such a way that your belly can actually easily expand. When we're more crunched or slouched, hard to engage the belly, the diaphragm. So you want to be sitting upright, but relaxed. So no need to overarch your low back. You just want to have a nice neutral spine, ears over the shoulders, shoulders melting away from the ears, and having your feet flat on the floor. So when our legs are crossed, it kind of tilts our hips a little bit, which tilts our torso. So you want to have your feet nice and flat. Ideally, your knees would be a little bit lower than your hips, if that's possible in the chair you're sitting in. Number two, you want to be breathing in and out through your nose. This warms and filters the air and also helps regulate airflow and can help us to not overbreathe or not hyperventilate. Number 3, we want to breathe fairly quietly. So when your breathing is nice and quiet, it's easy. You're not tensing or constricting anywhere. For example, if you're breathing like this, you're tensing and constricting. Of course, if you've got a stuffy nose or sinus polyps or something like that, that's a little bit different, but mostly we want the breath to be nice and quiet. We want the breath to be also nice and slow. This is something that can take a little bit of practice. And in terms of this technique as a practice, you want to get your breathing down to about 6 breaths a minute, somewhere around there. It doesn't have to be exact. And that might sound really, really slow, but I assure you it's definitely doable for most people with a little bit of practice. Number 5, we want the breath to be diaphragmatic. I'm sure many of you have heard about diaphragmatic breathing before, or belly breathing. When we engage the diaphragm, it tends to amplify what's going on in the more relaxed part of our nervous system. Number 6, you want to have your inhale and your exhale be equal in length, or have the exhale be a little bit longer. What we're trying to avoid is a long inhale and a short exhale, like a is what you're trying to avoid. And then number 7, this one is actually really important, less air than you think. We don't need to take these huge breaths in and out when we're at rest. We want our breathing to match our physical activity level. If you start to breathe in a lot and out a lot over and over and over again, deep breaths that we're all taught, you might actually start to feel a little bit dizzy or lightheaded or even more anxious. So with airflow or volume, easy does it. And if all that's hard to remember, you want to breathe low and slow and a little less air than you think. And so let's just take a moment to tune into ourselves, and feel free to participate if you want to. You don't have to. But just taking a moment to notice, maybe close your eyes if that feels okay, and just notice your own breathing, and see, are you holding your breath? Are you breathing? Are you breathing fast? Are you breathing slow? Are you breathing with your chest or your belly? Or are they both moving? Are you noticing that your breathing is even, or is your breathing inconsistent? What do you notice about your inhale and your exhale? Are you breathing through your nose or your mouth? All these kinds of things that we just talked about, just being a little bit curious about your breath. And no need to judge any of that, just observing. And now what I'll have you do if you want to participate is get yourself, if you're going to be sitting, 2 feet flat on the floor, nice upright spine, shoulders melting away from the ears. Even better, you can lie on the floor with your knees bent or a little pillow under your knees. So your belly is nice and relaxed. And I'll have you put one hand on your chest and one hand on your belly. And your only job in the whole entire world in this moment is to breathe so that you're really breathing into your belly hand. So your belly hand is moving a lot, and that your chest hand is really not moving much at all. So breathing so your belly moves first when you first breathe in, and breathing so your belly moves most. And once you feel like you've gotten that, checking in with some of those other things like breathing through your nose, seeing what it's like maybe to breathe a little bit slower than you were, having an even inhale and exhale, or maybe even having the exhale be a little bit longer, breathing evenly, regularly, and just notice how easy or challenging that feels. And I'm going to continue on, but my challenge to you is to keep tuning into your breathing and noticing what's happening as I finish up here. So this breathing practice is meant to really tone and exercise the peaceful part of your nervous system, the parasympathetic nervous system. What I have all of my patients do is breathe with a breathing pacer. So this can be on an app, or there's computer pacers too, for about 10 to 20 minutes a day. You can start with 5 minutes even, to just start giving your body some of that muscle memory practice, because breathing is a habit. And so we really need to do repetition to teach our body something new, which can shift a lot of things in our physiology. So breathing with a pacer app every day, about 6 breaths a minute, which is 5 seconds in and 5 seconds out. And then the other part of practicing breathing is starting to notice your breathing many times during the day. And every time you notice your breathing, just changing it a little bit, breathing a little bit more into your belly, a little bit slower, a little bit more regular. And the more and more you do this, the more and more your underlying breathing pattern will start to shift on its own, which is a really cool thing. So I think that's about my time. This is a list of breathing pacers that you can look up. I believe they're all free. You can screenshot this and look these up. And I just wanted to take a moment to thank you for tuning in and listening to this and having me today at this on the wellness panel. It's been a real pleasure. And take care, everybody. Bye-bye.